final area is STEMI, as everybody knows, and we can actually look at the frequency of EMS diagnosed STEMI, as well as the aspirin administration and nitroglycerin administration, and the time metrics here as well. The source is 1 year of data between August 1st, 2019 to August 30th, 2019. And it's all STEMI alerts. And it turns out there are 318 patients in this data set here as well. The frequency of aspirin administration, as recorded in the AMR chart, is approximately 75% here as well. It turns out that the remaining quarter may have actually either taken aspirin as prompted by dispatch or are on aspirin, but it's not quite clear in this database that we have right now. But obviously, if you're suspecting ACS, that aspirin is really one of the metrics that we need to pay attention to. Less important is the nitroglycerin as well, and this is a sort of interesting phenomenon where nitro, if you look at the data, it's not as doesn't lead to improved outcome like aspirin is, but we just wanted to find out how frequently nitro was being administered here as well. From patient's first side to first lead in 10 minutes, you can actually see that we were about 50% in performing the 12 lead. There is a potential error in this metric here because we did not see the data from FIRE. So I think if you combine the data from FIRE, our metrics would be much higher than what we actually see in the AMR chart here as well. Okay, from 12 lead to activation, as documented in the AMR chart for 5-minute metrics, we were only 48% on that metric here as well. So some room of improvement on that metric here as well. Total scene time, within reason, you can sort of see about 15 minutes was the mean scene time. That's within reason. We'd like to get that even down a little bit more, but that's currently what our metrics are. And this is the hospital. As you can sort of see, Adventist holds the lion's share of the patients requiring STEMI care here as well, with Manual and Providence, Portland. So as everybody knows, our STEMI corridor, as well as cardiac arrest corridor, are in the I-205 near southeast side of town here as well. So that makes a lot of sense here as well. My final 2 slides are upcoming attractions here as well. And as everybody knows, the real question is, when is the COVID-19 vaccine going to be marketed? And the answer is we really don't know. But my best guess for the EUA, which is the emergency use authorization, is sometime late 4th quarter or 1st quarter of 2021. Again, the EUA is for primary first responders as well as healthcare personnel and high-risk populations. Then the general population will be sometime in the 1st quarter or early 2nd quarter. And this is what I anticipate the vaccine to be available here as well. It will take us a while for the vaccine to be distributed because it's literally millions of people here as well. If you can sort of see the vaccine, there are 4 currently vaccines on the market that we are anticipating to come on the U.S. market. Of the 4 vaccines, 3 of them, with exception of Johnson & Johnson, are dual vaccines. In other words, you need 2 shots here as well. The other one, the Johnson & Johnson, is a one-time vaccine dose here as well. The other one, obviously, is the safety efficacy, and unfortunately, there's some political problems with the quote-unquote advertisement of the vaccine. So I think we're paying close attention to what is the safest vaccine, and are you willing to take the vaccine? Personally, I can tell you that I'm willing to take the vaccine if Dr. Fauci takes the vaccine as well. I'm saying this a little bit tongue-in-cheek, but I'm going to rely on my vaccine experts and look at the safety data before I receive the vaccine. But I think this is a true game changer, but we should look at 2021 before the vaccine will become widely available in the United States here as well. So that's once that actually happens, the real importance, as everybody knows on the vaccine, is that we can get back to our normal lives and not wear a mask. All of us are getting tired of that operation here as well. Finally, we actually have 2 research projects. One of them is the K-Central project, primarily be carried on AMR units here as well. And these are for head injury patients between GCS 3 and 12. We've done this study in a study setting here, and now we're going to perform it on quote unquote real world use here as well. The other slide portion you see is the Philips ultrasound, and we have a protocol sponsored by DARPA looking at ultrasound and basically smoke inhalation as well as compartment syndrome and extremity here as well. This will give us an opportunity to use handheld ultrasound, which I think has a vast untapped source of clinical efficacy in EMS here as well. So I'm looking forward to both of those research projects coming online. That's the end, and we'll take questions for that. Thank you.